A bone tumor is an abnormal growth of cells within the bone. Imagine a small seed growing inside a tree trunk. That's similar to how a bone tumor starts. These tumors can be benign, meaning they are not cancerous, or malignant, meaning they are cancerous and can spread to other parts of the body. Bone tumors are relatively uncommon, but they can affect people of all ages. Understanding the different types, causes, and treatments is crucial for early detection and effective management. The terms benign and malignant are used to describe the nature of tumors. Benign tumors are like well-behaved guests. They grow slowly and stay in one place. They don't invade nearby tissues or spread to other parts of the body. Malignant tumors, on the other hand, are more like unruly invaders. They grow rapidly, invade surrounding tissues, and can spread to distant organs through a process called metastasis. There are many types of bone tumors, each with its own unique characteristics and behavior. Understanding these differences is crucial for diagnosis and treatment. Bone tumors can be classified into benign and malignant categories. Benign tumors are non-cancerous and generally less aggressive, while malignant tumors are cancerous and can spread to other parts of the body. Some of the most common types of bone tumors include osteosarcoma, the most common type of malignant bone tumor, often affecting children and teenagers during growth spurts. It typically occurs in the long bones such as the arms and legs and can be very aggressive. Chondrosarcoma, a malignant tumor that develops in cartilage, the tough, flexible tissue that cushions bones. This type of tumor is more common in adults and can occur in any part of the body where cartilage is present. Ewing sarcoma, a rare but aggressive type of malignant bone tumor that typically affects children and young adults. It often starts in the bones but can also arise in the soft tissue around the bones. Giant cell tumor, a benign but locally aggressive tumor that can weaken bones and increase the risk of fractures. These tumors are most commonly found in the knee region but can occur in other bones as well. Fibrous dysplasia, a benign condition where normal bone is replaced with fibrous bone tissue, leading to weak areas in the bones. This can cause deformities and fractures over time. Multiple myeloma, a type of blood cancer that affects plasma cells in the bone marrow. It can cause bone pain, fractures, and other serious complications. Metastatic bone disease. This occurs when cancer from another part of the body spreads to the bones. It is a common complication of advanced cancers and can cause significant pain and fractures. Osteoid osteoma, a small benign tumor that often causes significant pain, especially at night. It typically affects the long bones of the body and is more common in young adults. Enchondroma, a benign cartilage tumor that usually occurs in the small bones of the hands and feet. While often asymptomatic, it can sometimes cause pain or lead to fractures. Aneurysmal bone cyst, a benign blood-filled bone lesion that can cause pain and swelling. It most commonly affects the spine and long bones of children and young adults. Non-ossifying fibroma, a common benign bone lesion that typically occurs in children and adolescents. It often resolves on its own without treatment but can sometimes cause fractures. Osteochondroma, a benign bone growth that usually occurs near the growth plates of long bones. It is the most common benign bone tumor and often discovered incidentally on X-rays. Understanding the different types of bone tumors is essential for proper diagnosis and treatment. Each type has its own unique characteristics, and knowing these can help guide the best course of action for patients. The exact causes of most bone tumors remain unknown. Despite extensive research, scientists have yet to pinpoint a single cause. However, they have identified several factors that can increase the likelihood of developing these tumors. Understanding these risk factors can help in early detection and prevention. However, several factors can increase the risk of developing these tumors, including genetic predispositions, environmental influences, and lifestyle choices. Let's delve deeper into some of these contributing factors. Genetics. Some people inherit gene mutations that make them more susceptible to bone tumors. These genetic mutations can be passed down through families, making it crucial for individuals with a family history of bone tumors to undergo regular screenings. Genetic counseling can also provide valuable insights and preventive measures. Radiation exposure. Exposure to high doses of radiation such as radiation therapy for cancer can increase the risk of developing bone tumors later in life. This is particularly concerning for cancer survivors who have undergone radiation treatment. It's important for these individuals to have regular follow-ups with their healthcare providers to monitor their bone health. Bone injuries. Severe bone injuries or infections may increase the risk of developing certain types of bone tumors. When a bone is injured, the body's natural healing process can sometimes go awry, leading to abnormal cell growth. This is why it's essential to properly treat and monitor severe bone injuries. Paget's disease of bone, this condition which causes abnormal bone growth and breakdown, can increase the risk of developing bone tumors. Paget's disease disrupts the normal cycle of bone renewal, leading to weakened bones that are more susceptible to tumors. Early diagnosis and treatment of Paget's disease can help mitigate this risk. Lifestyle choices. Maintaining a healthy lifestyle can also play a role in reducing the risk of bone tumors. Regular exercise, a balanced diet rich in calcium and vitamin D, and avoiding smoking and excessive alcohol consumption can all contribute to better bone health. By making these positive lifestyle changes, individuals can strengthen their bones and potentially lower their risk of developing bone tumors. In conclusion, while the exact causes of bone tumors remain elusive, understanding the risk factors can help in early detection and prevention. Genetics, radiation exposure, bone injuries, Paget's disease, and lifestyle choices all play a role in the development of bone tumors. By staying informed and proactive about bone health, individuals can take steps to reduce their risk and ensure early intervention if needed. Section 5. Recognizing the signs. Symptoms of bone tumors. Bone tumors often don't cause any symptoms in the early stages. This can make early detection quite challenging. Many people may not realize they have a bone tumor until it has grown significantly or caused noticeable symptoms. Regular checkups and being aware of any unusual changes in your body are crucial for early detection. As the tumor grows, it can press on nearby nerves or blood vessels, leading to symptoms such as persistent pain in the affected bone, especially at night or with activity. This pain can be dull or sharp and may come and go initially, but it often becomes more constant over time. It's important to note that this pain is not typically relieved by over-the-counter pain medications. You might also notice a noticeable lump or swelling over the affected bone. This lump can be firm or soft to the touch and may increase in size over time. Swelling can also cause the skin over the area to become red and warm. If you observe any unusual lumps or swelling, it's important to consult a healthcare professional for further evaluation. There's also limited range of motion in the affected joint, which can be quite concerning. This restriction can make everyday activities such as walking, bending, or lifting objects difficult and painful. In some cases, the joint may become stiff or locked, further limiting movement. Physical therapy and medical intervention may be necessary to manage these symptoms. Unexplained weakness or fatigue can also be a sign. This fatigue is often persistent and does not improve with rest. It can affect your overall energy levels and make it difficult to carry out daily tasks. In some cases, this weakness may be due to the body's response to the tumor, or the tumor's impact on nearby tissues and organs. And bones weakened by tumors are more prone to fractures. These fractures can occur with minimal or no trauma, such as a simple fall or even normal activities. This is because the tumor weakens the bone structure, making it more susceptible to breaking. If you experience a sudden fracture without a clear cause, it is important to seek medical attention to determine the underlying reason. Section 6. Diagnosis, shining a light on bone tumors. Diagnosing a bone tumor typically involves a combination of physical exam. Your doctor will examine the affected area for tenderness, swelling, and limited range of motion. Imaging tests, X-rays can reveal abnormalities in bone structure. CT scans and MRI scans provide more detailed images of the tumor and surrounding tissues. Biopsy. A small sample of the tumor is removed and examined under a microscope to determine if it's benign or malignant. Section 7. Treatment options, a path to recovery. The treatment for bone tumors depends on several factors, including the type of tumor, its stage, and the patient's overall health. Treatment options may include surgery. The most common treatment for bone tumors, surgery involves removing the tumor and some surrounding tissue. Chemotherapy, powerful drugs that kill cancer cells or stop them from dividing. Radiation therapy, high-energy rays that target and destroy cancer cells. Targeted therapy, drugs that specifically target and block the growth of cancer cells. Section 8. Living with bone tumors, hope and support. Living with a bone tumor can be challenging, but it's important to remember that you're not alone. Support groups, counseling, and other resources are available to help you cope with the emotional and physical aspects of the journey, Advances in medical technology and treatment options have significantly improved the outlook for people with bone tumors. With early detection, proper treatment, and a positive attitude, many individuals can live long and fulfilling lives. Section 9. Your health, your priority. Early detection saves lives. Bone tumors can be silent stalkers, often not causing symptoms in the early stages. That's why it's crucial to be aware of the signs and symptoms, and to seek medical attention if you experience any persistent pain, swelling, or other unusual symptoms. Remember, early detection is key to successful treatment and a brighter future. If you have any concerns, don't hesitate to talk to your doctor. Your health is your most valuable asset, so take charge and prioritize it.